Hello, everybody. Caleb Pearson here with Compass Financial Services. We'll start with a video here. We'll turn it off shortly, but I have Cathy with me as well.
Hello.
Hi, Cathy.
Hi.
Cathy Mears is with GBL. She'll be doing the bulk of the presentation today. So she's been with GBL for 15 years now. And before that, she was with Blue Cross as well for 26 years. And all that time, she's been dealing with Medicare and selling Medicare. So she is definitely an expert. So excited to hear from you here shortly. So I'll stop the video here. We'll just do audio from here on out. But a couple of housekeeping things before we get started. As I mentioned in the email, I'll mention it here as well. We'll be recording the presentation today. So if you can't catch it all, that's fine. We'll send an email out to everybody who's in attendance, as well as there's a handful of people who couldn't make it today, so I'll be sending it to them as well. And please feel free to share that with anyone who you think might want to hear the information. It'll be on our Facebook page as well, so you can find it there also. If you have any questions as we're going through the presentation, we have to disable the question and answer function with the Zoom meetings, but you can email me at caleb.pearson@compassiowa.com. You should see that on your screen. Or you can text our office line here, 515-327-1020, and I'll get a notification on that as well. When I sent out the link to the webinar, you should have received a PDF as an attachment there. Cathy's going to walk through that throughout the presentation. So if you're able to print that off, you can follow along there. If not, you can always just print it off after and everything. It's a handy tool to kind of gauge how much Medicare might cost for you specifically. So before we get started, our industry does require us to read a disclosure before these. So you can see it at the bottom of your screen if you want to follow along. Group Benefits Limited is not affiliated with Compass Financial Services or LPL Financial. Securities are offered through LPL Financial, member FINRA SIPC. Investment advice offered through Compass Financial Services, who's a registered investment advisor and separate entity from LPL Financial. So with that, we'll switch over here to Cathy's presentation and she'll take the floor.
Hello, thank you very much. Thanks for having me today. This is actually, believe it or not, my first Zoom meeting that I'm doing. So a little nervous to begin with, but I think everything will go fine, hopefully. So what we're going to do today is kind of consider some medical costs in retirement. Our agenda today is a Medicare primer. We want to make sure that all of our parts of Medicare are working correctly, estimating our medical costs, expenses, some final thoughts and recommendations, and then also questions at the end. What is Medicare? So Medicare is a health insurance program for individuals 65 and older, or those of us that are under 65 and we have certain disabilities. It's administered through the Centers for Medicare and Medicaid Services, also called CMS, and enrollment is done in the Social Security Administration, or railroad, if we're a railroad retiree person. In the beginning, Medicare signed into law in 1965 by President Johnson. So we see him sitting there at the table signing that into law. And that little gentleman to the right of him was the first recipient. Usually I always ask if anybody has any idea who that first recipient was. And you can think about it for a minute. It was Harry Truman. He was age 81 when he signed the first Medicare. And we always say his number was probably Medicare number 1. Back then, average life expectancy was 68 years of age, and Medicare Part B premiums were $3 a month. So we can probably assume that that's probably gone up a little bit from now. 44 million people today are enrolled in Medicare. In the beginning, it was only 19 million. So today, 44 million. And they say by the year 2030, there'll be 79 million people enrolled in Medicare. And it's because of all the baby boomers. I think it's 10,000 people a day are turning 65 in the United States. So got a lot more people coming in. There are two parts of original Medicare, simply Medicare Part A and Medicare Part B. also known as hospital and medical insurance. Part A is hospital, Part B is medical insurance. Medicare Part A provides partial coverage for inpatient care, whether it's in the hospital, in a skilled nursing facility. We have some hospice care that's covered and also some home health care that's covered under original Medicare Part A. Most people are eligible when they turn 65 if they've worked 10 years or 40 quarters and paid Medicare taxes through their paychecks during that time. Or again, we can qualify prior to age 65 if we have certain diseases. If the above applies, your Medicare Part A is free. I would like to start with that. Medicare Part A comes to us at no cost. Should I enroll? That's a big question. First of all, if you are pulling Social Security benefits prior to turning 65, you're going to be automatically enrolled in Medicare Part A and Part B. So you're going to get a nice little card, we call it the little red, white, and blue card that shows you have Medicare Part A that starts the first of the month that you turn 65. For individuals that are not pulling Social Security benefits or may be covered under employers or their spouse's employer group plan, you may want to decline Medicare, and we'll talk a little bit more about that. But if you are not pulling Social Security benefits, and let's say you've turned 65 and you're still actively employed, covered under your employer group plan. If your employer group is over 20 employees, you may want to go ahead and enroll in Medicare Part A. It doesn't cost anything. Employer groups 20 employees or more, the group plan is going to be primary. So group will pay first, and this could be a little secondary coverage for you if you have one of those, an inpatient hospital stay or the skilled nursing facility services. To enroll in Medicare Part A, you go out to socialsecurity.gov and enroll. I know that's what's confusing because we're not enrolling in our Social Security benefits, we're just have to enroll in Medicare on the Social Security website. Under 20 employees, it gets a little rough whether we want to enroll or not. And a lot of it depends on what insurance we have through our employer. So we really want to look at that. So we may not want to enroll in Medicare Part A. If on our employer group plan, we're on one of those high deductible health plans and contributing to the savings account, you probably don't want to enroll in Medicare Part A, because once you enroll in Medicare Part A, you can no longer contribute to that savings account. Remember I said Medicare Part A was partial coverage. So basically what would happen is if Medicare is your primary insurance, Medicare has a deductible, the Part A deductible. It's $1,408 this year. That's our first 60 days in the hospital. And these dollar amounts change a little bit every year. This is the 2020 information that we have right now. The 2021 won't be out until mid-December, so they're pretty late about getting them out. But again, basically, if I'm admitted into the hospital, Medicare says you owe that Part A deductible. If I'm in the hospital for more than 60 straight days, days 61 to 90, Medicare pays all but $352 a day. So I'm responsible for that. Heaven forbid I'm in the hospital for more than 90 straight days, day 91 to 150, Medicare pays all but $704 a day. That's my responsibility. We have what those figures would be if we were in for those lengths of times. Medicare's done if we're in the hospital for 150 straight days or more. So Medicare pays zero and we would pay all costs. Again, under Medicare Part A is our skilled nursing facility care. So after a 3-day hospital stay, and then we go into a skilled facility within 30 days, the first 20 days of that stay, Medicare pays all approved amounts. Day 21 to 100, Medicare pays all but $176 a day. So that $176 a day is our responsibility. Medicare's done at 100 straight days in the skilled facility because we're probably not going home. And that's when those nursing home policies or long-term care policies would kick in after that, because they usually have a 90-day or 100-day elimination period. Oh, this is that audience participation. You guys have this little form. If you want to pull that out, this is where we put. So if we have worked at least 10 years or 40 quarters, we can put our Medicare Part A is free. So you can put a big 0 in there. Kind of shows you what Medicare Part A would cost if we didn't work those 40 quarters, 30 to 39 or under 30 quarters. Can get kind of expensive. Medicare Part B, medical insurance. This again is partial coverage. Medicare Part B is going to cover anything that's not inpatient, so outpatient emergency rooms, outpatient surgery, our MRIs, our doctor's office visits, home health care, durable medical equipment is covered under Medicare Part B. Also some rehab, physical therapy is covered under Medicare Part B. Medicare will give us a one-time welcome to Medicare preventative visit, and then we get yearly wellness visits after that every year. Flu shots, pneumonia shots, a lot of screenings are covered under original Medicare Part B. Normally those wellness and screenings are all covered at 0 out of pocket as long as our doctor accepts assignment with Medicare. So they're covered at 100%, like our group health plans that we have today, the healthcare reform. Anyone that's eligible for Medicare Part A is eligible for Medicare Part B by enrolling and paying a monthly premium. The standard premium in 2020 is $144.60. And we'll talk a little bit about more of this in a minute. Again, this is the 2020. It could change again a little bit for 2021. Should I enroll in Medicare Part B? If you're going to be coming off of a group plan, by all means, yes. If we're going to retire, about the time we turn 65, we'd want A and B. If I'm still going to be actively employed and covered under my employer group plan, then no, I probably don't want Medicare Part B. First of all, because there's a cost. The minute you start Medicare Part B starts a one-time only open enrollment period where you can go to a Medicare supplement without answering health questions. So we probably wouldn't want Medicare Part B until the time we're no longer going to be actively employed and we're going to be coming off of that employer group plan. So at that time, then what we have to do when we're outside of our 65th birthday month, then the 3 months after our 65th birthday month, we have a special enrollment time. And there's going to be a form that our employer or our spouse's employer will need to fill out stating that there's been active employment and we've been covered under that employer group plan, so they don't try to impose a penalty on us for not taking Medicare Part B out when I first turned 65. So again, there'll be a form. So we have to prove that we didn't want Medicare Part B there because there was a cost. And I'll take A to, help pay against our hospital services, but I can take care of my doctor's office visits myself. They want to make sure that we're in when we're either first turned 65 or at least within 8 months of no longer active employment to avoid a penalty down the road for Medicare Part B. This shows the details for the Medicare Part B. There's a deductible there as well. The Part B deductible this year is $198. So the first time you have Part B service, you're going to pay that Part B deductible. And then basically Medicare is going to pay 80% and the 20% would be our responsibility. Some services are covered at 100%. Again, a lot of our wellness exams, our x-rays and labs, and our home health care is covered at 100%. Here's where we talk a little bit more about the Part B premiums. There was a Medicare Modernization Act of 2003 that established income-related Part B premiums. It used to be everybody paid the same amount for Medicare Part B, and this little act changed all that. So now it's going to be based on our income. So it's going to go anywhere for a married couple from $87,000 up to $174,000. If we make more than that, we can pay more for our Medicare Part B. Remember I said that standard premium was $144.60. If we're in higher brackets, we could pay anywhere from $202 a month up to $491 a month for our Medicare Part B. And again, we'll talk a little bit more about this in a minute. There was just recently a freeze where they couldn't change those thresholds, but that just changed this year. And again, we are seeing more people are paying a higher Part B premium than in the past. Okay, we're at this part of our premium for the Medicare Part B. So again, if we're a single individual, how we file our tax returns, making $87,000 or less, then you get that standard premium of $144.60. So you can put that right in that little field on our chart. If we are a married couple making $174,000 or less, then we also get that standard premium. So we see as we make more, we pay more. This can change throughout our time on Medicare. What they're going to do is when you first enroll is look at your last tax return on file. So certainly we might be over to begin with. We can always file an appeal. You know, if we leave work mid-year, we can say, well, hey, I'm not going to make that much money this year. And so we can appeal it, and very likely we could win. Or let's say our employer let us go, but gave us a severance package that had a dollar amount to it, you know, and bumped us into a different bracket. We can always appeal it because our income wasn't that much. And this was just kind of a one-time thing. But let's say all of a sudden we're retired and then we decide we want to be a snowbird and go buy a condo down in Arizona. If we pull money out of a 401k that could bump us into that different bracket, you're going to get a letter from Social Security Administration. So they're going to go look at your tax return every year. So you're going to get a letter that says, hey, we see that you fell into this single individual 109 to 136,000. So now for the year, you get to pay $289 for your Part B premium. And then again, it would go back down again that next year. So again, this can go up and down throughout our time on Medicare. And again, those thresholds can certainly change every year too. Last year was 85,000 or less, and it went up to 87,000 or less this year for that standard premium. So again, just want to make sure that everybody knows we're not just set on that Part B premium forever and ever. Those Part B premiums, again, can change every year as well. So again, and wherever you fall into, if you want to put that in your Medicare Part B premium, then you'll know what you'll pay for Medicare Part B. If you're pulling Social Security benefits, they're going to automatically take that amount out of your Social Security check. If you're not pulling benefits, they're going to send you a bill. So you need to make sure you watch for that bill, and you'll need to pay it. Usually it's a quarterly bill that they send out, and you want to make sure you pay it. Because if you don't, they're going to disenroll you out of Medicare Part B, and then it's going to take some time for you to get back in, and then you'll pay a penalty. So where are the gaps? Remember all the deductibles and the per day copayment amounts that we talked about earlier? There's kind of a rundown here of what we could pay out of our pocket every year. Medicare doesn't cover us outside of the country, so anything outside of the country, you're going to might want to look at a little travel plan, and then our prescription drug plans. There's some gaps too. Only about 1 in every 10 people solely depend on Medicare Part A and Part B only. It's just 1 out of 10. Normally, individuals are going to look at a Medicare supplement, a Medicare Advantage plan, and prescription drug plans. And those are what we're going to talk about now. That's a lot of out of pocket for us to handle in a calendar year. So again, what individuals may do is look at a Medicare supplement, or they call them a Medigap plan, to fill in all those gaps, or a Medicare Advantage plan. And we'll talk a little bit about those options today. Medicare Advantage plans, first of all, it's kind of an alternative to Medicare. It kind of replaces Medicare. We're still enrolled in Medicare Part A and have to pay that Part B premium, but Medicare would not be our primary insurance. We'd want to put our little Medicare red, white, and blue card away. We don't want to show it to anybody. We're just going to have one card that we would show, just like we do today under a group plan, to the doctors and to the hospitals and to our pharmacies. So Medicare Advantage plans kind of bundle our Medicare, our medical, and our prescription plans all into one policy. with these Medicare Advantage plans, if original Medicare would have covered our services, those Medicare Advantage plans have to cover them as well. There's going to be 3 different types. There's a private fee-for-service. With a private fee-for-service, they tell you can go to whatever doctor you want. It's just that you need to ask the doctor each time you go if they'll accept you. So they might accept you the first time and then filed a claim and thought it was a nightmare and not accept you anymore. So those Medicare private fee-for-service plans don't actually go out and contract with providers and tell you what doctor you can go to. Or we're going to look at the PPOs or the HMOs. So the HMOs, the health maintenance organizations, there's going to be a list of doctors you need to go to. You always want to go to one of those doctors. If you go to somebody that's not on the list, it's only going to be covered if it was an emergency. Under the PPOs, the preferred provider organizations, there's still going to be a list of doctors you need to go to. As long as you go to one of those doctors, you have lower copays, lower out-of-pocket maximums. You can go off the list if you want. You're just going to pay a little bit more, higher copays, higher out-of-pocket maximums. Emergency services are always going to be covered as in-network under the Medicare Advantage plans. These plans are offered through insurance carriers. So we would get with an agent or an insurance company, you're going to start seeing a lot of ads. Today is the first day we can start talking about the new Medicare plans for 2021 and the Medicare annual election period where people can change Medicare Advantage plans is from October 15th to December 7th each year. So a lot of TV ads are going to be coming on, a lot of stuff in the mail is going to be sent out to individuals. The other alternative to a Medicare Advantage plan would be a Medicare supplemental plans. These plans have always been the most popular plan throughout the years. The Medicare Advantage plans didn't come out until 2006. The Medicare Advantage or the Medicare supplement plans filled in those gaps from original Medicare. There's 11 standardized plans, also alpha charactered A through N. The nice thing about this is it makes these plans easy to shop. So if we look at a Plan G is the exact same benefits, whether you get it from Blue Cross and Blue Shield, United Healthcare, or Mutual of Omaha. Benefits are identical. Premiums might be different, but the benefits are going to be identical. These plans do have a monthly premium associated with them. Usually under a Medicare Advantage plan, those might have a 0 monthly premium or very low premiums, but those Medicare Advantage plans, you pay for your services as you go. Generally under these Medicare supplemental policies, you have very low out-of-pocket expenses when you go to a doctor and to the hospital, but you do have that monthly premium you're going to pay every month. So it makes it a little bit easier to budget under the Medicare supplement because you know what your premium is going to be every month. About 97% of the people in the past have always enrolled in a Medicare Supplement Plan F. If any of you know other people that if you haven't turned 65 and you're getting close to it, everybody might tell you, yes, you need that Medicare Supplement Plan F. Well, that plan unfortunately went off the market January 1st of this year. For any of us young kids just turning 65, January 1st of 2020, Plan F is no longer available to us. If you are 66 and you're still actively working, as long as you were 65 prior to January 1st of 2020, you could still have a Plan F. But Plan G is that new kid on the block that's going to be the most popular plan from here on out for people turning 65. Average cost of somebody turning 65 is anywhere from $90 to $150 a month. Remember, this is on top of that Medicare Part B premium that we would have. Generally, these plans are going to have rate increases every year, usually single-digit increases, so that's nice. But they will most likely change every month of the monthly premiums. Here is a look at the Medicare supplemental plans. The Plan F is over on the right, far right, and then we've got Plan G, fourth of the way in. So when we look down the benefits under the plan, both Plan F and Plan G, about halfway down that chart, see it shows it pays that Part A deductible for us under both plans. So that Part A deductible was at $1,408 if I'm admitted into the hospital. Right above that, it shows it covers a skilled nursing facility. That's that per day copay, that $176 for day 21 to 100 in the skilled facility. Both of them pay that. The one box that's not filled in under the Plan G is that Part B deductible. You look over on the right under the Plan F, it pays that Part B deductible for us. So basically, that's the only difference between Plan F and Plan G, is under that Plan G, we're going to have to pay that annual Part B deductible, which was $198 this year. And then remember, Medicare pays 80%. The 20% is covered under that first little box, the basic benefits. And that Part B coinsurance, that's the 20%. It's called the coinsurance. The other nice benefit under both Plan F and Plan G is the Part B excess being covered at 100%. So when I go into the Medicare supplemental world, it doesn't matter what insurance company I get my plan with, whether it's Blue Cross or United Healthcare, and what doctor I go to. It's just doctors will accept assignment with Medicare. They don't generally participate with the insurance companies or with our Medicare supplements. So let's say you go to the doctor and he charges $100 for your visit, but Medicare only allows $90. I'm sure we've seen that on our explanation of benefits today, where the insurance companies never allow what the doctor charged. Well, if that doctor accepts assignment with Medicare, he agrees to that $90 allowance, and he'll write off that $10 difference. If he does not accept assignment with Medicare, he could balance bill you that $10 difference. Well, that Part B excess is going to pay that $10 difference for you. So that allows you to go to any doctor in any state. So the way we've always looked at the Plan F is, as long as the services are covered by Medicare, because they get the claims first, so they're the dictator now, under that Plan F, there'll be nothing left due out of your pocket, and you can see any doctor in any state. Under this Plan G now, as long as the services are covered by Medicare, the only thing due out of your pocket is going to be that annual Part B deductible each year. Again, they're all, both Plan F and Plan G do just have a little foreign travel emergency benefit there. Very small benefit, covers us the first 60 days outside of the country. We have a deductible we pay and then a coinsurance. It only has a $50,000 lifetime maximum. So if you are going to go abroad, you would want to get a travel plan. You can always check with your travel agent, or there are some travel plans that are out there for individuals to can purchase as well. So here we've got some average costs of the Plan G. If any of you are over age 65, you could probably add $10 to $15 or more a month on these rates. So these plan rates are gender rated and age rated for when we come in. So you can kind of see where you're at there and put that dollar amount into the supplemental premium. So again, what we would have is be two cards that we would show to our doctors and to the hospitals. Claims go to Medicare first, they apply their deductibles, and then it comes on over to our supplemental policies for us. So we've got probably Medicare Part A as 0, that Medicare Part B premium, and then here's our Medicare supplement premium that we will have. Here we've kind of taken a look at a Medicare Advantage plan versus a Medicare supplement. So over on the left, it kind of shows a Medicare Advantage plan. Again, most of these are a 0 monthly premium. I'm still paying that Part B premium. Remember that Part $144.60, but this plan itself doesn't have a monthly premium associated with it. But what's going to happen is I'm going to pay for services as I go. So maybe a primary care doctor, as long as they're in network, is a $5 copay. Specialists, a little bit higher copay. If I go out of network, because I can if this is a PPO, so we're showing a PPO here. Out of network, I can go to a doctor that's not on the list, but I'm going to pay 40% of the bill. We have our preventative services that are 0 out of pocket. We have our urgent care. With these Medicare Advantage plans, if you're out of network, you'll have, let's say you're down in Arizona for 2 weeks and you get a cold. You'll want to go to one of those walk-in clinics. Because if you go to just any old doctor, you could pay 40%. But if you walk into that urgent care, you're going to have that copay. Some of the Medicare Advantage plans now, they're getting kind of smart up here in Iowa because we have a lot of snowbirds. They're having some nice travel benefits. I know United Healthcare has a national network that they work with now whenever we're traveling about. There's another carrier that if we're going to be gone for more than 30 days, we let them know we're going to be gone. If any claim comes in while we're gone, it's covered at 100%. So they've gotten a little wise for us snowbirds that might be going south and where these plans used to not work so well when we were outside of the area. Normally under a Medicare Advantage plan where we could experience a lot of out-of-pocket costs is that inpatient hospital stay. So we could pay $435 per day for days 1 through 4. But all of my copays are going to accumulate into my out-of-pocket maximum. So you can see down there at the bottom, in network, I could pay $3,700. If I can go out of network on a PPO, I'm going to pay up to $6,700. And then
I did have a question come in.
Okay.
Since we're talking about it here, I'll bring it up. A question came in from a client. Are there problems switching to traditional supplemental versus Advantage with pre-existing conditions?
When we first turn age 65 and enroll in a Medicare Advantage plan, we have a 1-year free look. So at any time in that first 12 months, if I think, golly, I want to go back to a supplement where I just pay that monthly premium and I don't have to worry about what doctor I go to or anything due out of my pocket, you can do that anytime in that first 12 months. You can go back to a plan F or a plan G, depending if you're over 65 now or just turning 65. So let's say at the end of that first year, you think, golly, this worked pretty good. Instead of paying $1,500 a year in premiums, like I would under a Medicare supplement, that I only went to the doctor once or twice, so I might be out $100 for the year. I think I'm going to stay on this Medicare Advantage plan. Now I'm in year 2 or year 3. If I ever want to go back to a supplement, I'm going to have to answer health questions to go to a supplement. There are some guaranteed issue rights. A guaranteed issue right with these Medicare Advantage plans, we have to live in a certain county. So you can always move outside of a county that the plan's in. Sometimes a carrier might take their plan off the market. If they take their plan off the market, then that gives you a guaranteed issue right to go back to a supplement without any health questions at all asked. So let's say you're on a Medicare supplement right now. You've been on one since you turned 65 and you want to take one of these Medicare Advantage plans for a test drive. You can do that now between October 15th and December 7th. That new plan will start January 1st. Again, you have a 1-year free look because you've already been on a Medicare supplement and now you're trying one of these for the first time. So you enroll in that plan, starts January 1st, you have a 12-month trial right. So at any time in that 12 months, whether it's a second month in or it's the 11th hour, you decide you want to go back to your supplement, the Medicare supplement plan you dropped has to take you back without any health questions at all asked. If I'm on this plan and I think, golly, this worked pretty good this year, so I'm just going to let it automatically enroll for the next plan year. Again, I'm in year 2 or year 3 under a Medicare Advantage plan. Now I'm getting older and I think I want to go back to a supplement where I just pay that monthly premium. You have to answer health questions. But again, you'd still have those guaranteed issue rights where you can move outside of the county or if they take their plan off the market. Otherwise, the Medicare Advantage plans, you can shop every year because those plans are going to change out from underneath you every year. Our copays can change, our premiums could change on those, where the Medicare supplements have been the same since the early 90s. Those benefits haven't changed at all. The Medicare Advantage plans, you can shop every year from October 15th to December 7th, no health questions at all asked. Or again, they've just had a Medicare open enrollment period for the Medicare Advantage plans, whereas maybe you missed the annual election period, the October 15th to December 7th. And now all of a sudden in February, you found out from your neighbor has some new plan XYZ that you didn't hear about. You still have from January 1st to March 31st to change to another Medicare Advantage plan. With a Medicare supplement plan, you have a one-time only open enrollment period. That's when you first turn 65 or when you're over age 65, just enrolling in Medicare Part B. So with your Part B effective date starts your one-time only open enrollment period to go to a Medicare supplement. If I ever want to change from like a Plan F to a Plan G later, or change from a Mutual of Omaha to a Blue Cross and Blue Shield, I have to answer health questions. All right. Medicare Part D. D stands for drug. That's about the only one that really makes sense, isn't it? Medicare Part D. Again, these plans didn't come out until 2006. Prior to 2006, there was a couple Medicare supplements that covered some prescriptions, but they were over $500 a month, and they only covered about 50% of our drugs. So they knew something needed to be done. So the government stepped in, and they came out with these prescription drug plans. They are plans that you have to get from a private insurance company. And most of the Medicare Advantage plans have the prescriptions bundled in with that at that $0 monthly premium. Sometimes our employers might offer a Medicare Advantage plan to the retirees. So we're seeing some of that as well. The drug plan is going to work the same, whether it's a standalone prescription drug plan or if it's one that's bundled in with the Medicare Advantage plan. So again, this is a plan that does have limited coverage for our prescriptions, wide variety of plans and costs. In fact, I just saw today, since the 2021 plans came out, there's 28 different drug plans in Iowa this year. This is where it's going to be challenging for us to try to get a dollar amount for you guys, but we have some things to look at here. All of the drug plans have a different formulary for our prescriptions, and they might have a pharmacy network that they prefer you to use to get your lower copays. What we're looking at here is the standard plan design for 2020. I do have the updated 2021 in my hands. However, since we had to get this over to you about a month ago, we couldn't talk about the drug plans until October 1st. So I'll tell you where they're going to change a little bit from year to year. Instead of, like the Medicare supplements, those plans are all the same, identical benefits from company to company. So what the government did here was just come out with a standard plan design. So they told the insurance companies, if you want to offer coverage, here you go, has to at least be this good. And this does get tweaked a little bit every year. So this is the 2020 design right now. All 28 plans have 4 different stages. And again, these stages are the same, even if it's a Medicare Advantage plan that has the prescriptions bundled in with it. So the first stage is a deductible. If the plan has a deductible this year, it can't be more than $435. 2021 is going to be $445. So some plans have a deductible, some have a 0 deductible, some have the deductible, but they tell you it's waived if your drug is on their generic formulary list. So again, Medicare just tells the insurance company how high that deductible can be in a calendar year. The second stage is the initial coverage stage. This is probably like your employer group plans today. So depending on where your drug shows up on their formulary list, you might have a copay or a coinsurance. In the Medicare world, they're called tiers. So there's 5 different tiers. So a tier 1 and a tier 2 is a generic. Tier 3 might be a preferred brand, and then they have brand name and specialty drugs. So the lower the tier, the lower out of pocket you will have at the pharmacy when you pick up your prescriptions, because you usually will always have to pay for prescriptions when you pick them up at the pharmacy. There's not a drug plan that looks like a Plan F, where I just pay that monthly premium and I don't have to pay anything out of my pocket. We will always have cost sharing with our prescriptions. But basically in this initial coverage stage, the plan is paying about 75% and we're paying 25% on an average. But that is a lot lower if our drug's on the generic list, because often we are paying a zero copay at the pharmacy. The third stage is the coverage gap, or the dreaded donut hole, if anybody's heard that expression. Once my drug costs reach $4,020, and again for 2021 it's going to be $4,130, so it's going up a little bit, I fall into this gap. It used to be once I hit this donut hole, I had to pay 100% of my drugs until I paid that $6,350. See where that's at in the white box there at the very end sentence? My out-of-pocket reached $6,350. But one of the things healthcare reform was trying to do was get that 100% down to 25%. And that happened this year in 2020 when Plan F went off the market. So now once I hit that donut hole, I will pay 25% of the cost of a generic drug and 25% of the cost of a brand name drug until I've paid that $6,350 out of pocket. Next year it's going to $6,550. And that's not an out-of-pocket maximum. That just gets me to the fourth stage, the catastrophic stage. So for the rest of the year, I'm going to pay either $3.60 for a generic, $8.95 for a brand name, or 5% of the cost, whichever is greater, to December 31st, and then it starts all over again January 1st. But let's go back to that donut hole a minute. The drug plans is the most confusing part of coming off of a group plan and going into the Medicare market because of this donut hole. So to get to that donut hole, that coverage gap of $4,020, it's going to look at the cost of my drug. So I always use the example of somebody that's insulin diabetic. There's these flex pins that come in a box. 5 pins come in the box. They usually retail about $380. I might only have a $47 copay when I pick those up, but it's that $380 that's going to get me to that $4,020. So you can imagine you're probably going to hit that donut hole by October, because you probably have a couple more drugs besides just the insulin if you're insulin diabetic. So it's that $380, the cost of the drug, that's going to get me to the donut hole. To get out, they're going to look at what I have paid out of my pocket. So again, might have had that $435 deductible. I got the copays or co-insurance in the initial coverage stage. Usually when my drug costs have reached $4,020, I've only paid about $900 out of my pocket. So I have to go to $6,350 to get to that catastrophic stage. So that's a long ways to go. So to get to the donut hole, they're going to look at the cost of the drug. To get out, they're going to look at what I've paid out of my pocket. You do get an explanation of benefits either every month or every quarter that tells you where you are in all 4 of these different stages through Medicare. You know, if you're met the deductible, a little bit of a deductible, they'll tell you how much further do you go. Once you're in the initial coverage stage, they'll tell you how much farther you have to go to get to that coverage gap. So they do keep you on top of those. The nice thing about these plans is we can shop every year because our needs change. So if we have somebody that's not taking any prescriptions at all, they may want to look at something, a low cost plan, just to make sure they're covered and they don't have to pay a penalty, which we'll talk about in a minute. Otherwise, we want to shop every year because these plans are also going to change out from underneath us every year. New plans come in, plans go out, deductibles change, copays that we pay at the pharmacies will change, and also they change their preferred pharmacies. So in the Medicare world, these drug plans are going to have a preferred pharmacy network, a standard pharmacy network, or an out-of-network pharmacy. So they'd prefer you to go to those preferred pharmacies, and as long as you do, you have lower copays. You go to a standard pharmacy, still going to be covered, you're just going to pay a higher copay. You don't want to go to an out-of-network pharmacy because then you're going to pay 100% of those costs. So once we're enrolled in one of these plans, we're kind of locked in until that next annual election period, which is October 15th to December 7th. So a lot of people, the last 2 weeks, about last 2 weeks of September, they get their annual notice of change. And it's a nice side-by-side comparison that shows here's how the plan worked in 2020, Here's how it's going to change in 2021. And it'll show premium, whether it went up or down. Believe it or not, some premiums do actually go down. I think we get more calls when the premiums go down because they think something's wrong. But they can go up and down. They'll show you whether the deductible changed at all, and it'll show you whether the copays changed at all for the different tiers. So you can always shop. I know Medicare.gov has a nice site. You can go out and look at those, or if you have an agent you work with, they can shop for your plans for you every year. Today was our first viewing of the plans, because the Medicare.gov website is actually updated now with the 2021 plan designs. So between October 15th to December 7th, you can change a new plan that will start January 1st, because it's going to be on a calendar year basis. If you do nothing, you're automatically renewed into that plan for the next plan year. But if you want to make a change, you want to do that by December 7th. So usually you want to shop if you have any new prescriptions. If the premium goes up more than a couple bucks, you might want to shop. And if you haven't shopped for 3 or 4 years, you might want to shop, because lots of times there's new kids that come on the block that have the nice low premiums to try to attract you. So again, no health questions are asked at all under the prescription drug plans between October 15th to December 7th under these plans. So let's say you're one of those individuals that don't take any prescriptions at all, which would be very lucky for you. And you say, by golly, why should I have to pay for a plan if I don't take any prescriptions? Well, I always tell people they don't have to enroll in a drug plan. It is an optional benefit. However, if you don't enroll when you're first eligible, your first eligibility is when you first turn 65. You have the 3 months before your birthday, the month of, and 3 months after to enroll in a drug plan. If you don't enroll in a plan then, if you ever want one down the road, you're going to pay a penalty. So let's just say I had somebody that turned 65 in March, and by golly, he wasn't going to enroll in a plan because he didn't want to pay for it because he didn't take any drugs. So he turned 65 in March. So he had April, May, and June to enroll in a plan. All of a sudden in September, he calls me, he had major illness and wants to enroll in a drug plan. I can't enroll him in a plan. He has to wait until the annual election period, which is October 15th to December 7th, and that new plan starts January 1st. And then what the government's going to do is come back and impose a penalty for the 7 months he didn't have a plan when he was first eligible. So the penalty is 1% per month you didn't enroll in a plan when you were first eligible, and is 1% of the national average cost of a drug plan, which is right about $32 this year. So roughly it'd be 32 cents times 7, which would be what? I didn't bring my calculator. $2.50 a month, not much. Yeah. But what the government's going to do is come back and impose a penalty, and it's not a one-time penalty. You're going to pay $2.50 a month forever and ever on top of the monthly cost of a drug plan. So that penalty is going to go with you your entire time on a prescription drug plan. And again, let's say at the end of that year, that person still wasn't on any drugs. So now we're in this open enrollment period right now. So we're looking at a 2021 plan. He said, nope, I'm still not going to enroll in a plan. We get into 2021, something comes up, can't enroll him in a plan, but he can enroll during that annual election period, October 15th to December 7th, and it would start January 1st of 2022. Now we got 12 months and the 7, so now we're at a 19% penalty. So it just keeps going up from there. But it is an optional benefit. You don't have to enroll in a prescription drug plan. The national average, again, the cost of a drug plan was $32.74 this year. Our premiums ran anywhere from $12.40 to $76.40 for a drug plan, standalone prescription drug plan. This year, there's a new kid on the block that I just saw today, that premium's $7.30. Otherwise, the lowest premium was that $12.40. So people might want to shop and see if that plan works out good for them for next year. So here we go. Oh, remember that income-related monthly adjustment amount? that was on Medicare Part B. It's also on the drug plan since the government oversees these plans. So if we're in a higher bracket, we could pay more for our prescription drug plans. So again, we're not quite sure on a drug plan on what one would work best from you. So if you aren't taking any of your drugs, you might want to just put that $32.74 in that monthly premium for average cost, or again, the lowest cost is $12.40 this year. Plus, if we're in a higher bracket, we can add an additional $12.20, clear up to $76.40 for a drug plan and what we're going to be paying. And that's just for the premium. So we can put that amount in that little box there. And again, we have a lot of out-of-pocket expenses for the prescription drug plans. We're going to have deductibles and then our co-pays and the donut hole expenses, and we still even pay in our catastrophic, so we're never have an out-of-pocket maximum for our prescriptions that are out there. So we're going to have some out-of-pocket expenses, and this will be where it's going to be kind of hard to judge. We did an average here. So of course, if nobody takes any prescriptions, when we're looking at the drug plans, you can put a 0 in there, and you would just be paying that monthly premium. If I take 6 or less prescriptions, and I looked at a high blood pressure, high cholesterol, you know, those common ones that we might be taking, 6 or less, we might add an extra $50 a month. We would pay at the pharmacy for prescriptions. If we take over 6, we could pay a lot more. So when I looked at this one, I was looking at somebody that was insulin diabetic and also somebody that had an inhaler that they had to use. Then we might need to add an additional $300. And that was kind of an average. You know, when we look at those 4 different stages in the drug plans, the first couple of months, it's not bad, but until we hit that donut hole, then that's where it really goes up. But throughout the 12 months, we might want to average $300 a month, but it's going to look a little bit different when we look at it for an entire year for everybody. So you can put that amount in there for your out-of-pocket expenses for your prescriptions at the pharmacy. Now, all of these carriers will have a mail order option that's available where it can usually cut down on some prescription costs out of pocket for us. So you would get that in your enrollment kits. So projecting the future. Costs are likely to go up. You know, I always tell people at least figure your Medicare supplement might go up about 10%. And if it's less than that, then we've saved some money. So we know costs are going to go up. Here's a little example at the bottom of that sheet. We can put in, if we add up all of our sums on that chart we were looking at, we get our monthly premium we would pay and take that times 12, and you'll have what you'll pay for the year. So you can budget that. If you want to look at 5 years out or 10 years out, some smart math person figured out what we had to take that up, that yearly premium times it by to get a projected cost from 5 years and a projected cost for 10 years out. So it's kind of fun to take a look at or not on what those costs might be. So this is how we always leave our webinar, is to never retire, and we won't have to look at those high costs of the prescriptions and the Medicare plans. I think that's it for me. So if we have some questions, I will try to answer those for you guys.
Yeah, I want to step in here. This is Guy Lehman, advisor and owner here at Compass. And thank you, Cathy, for all that information.
You're welcome.
And we will have some, we do have some questions, I think, coming up. No questions? All right.
Oh, yeah.
But what we see here at Compass is that making that transition from group coverage or individual coverage to Medicare really depends on the situation, because we have some folks that are coming from very generous group plans that are paying virtually very little or nothing sometimes for their health care.
Correct.
And they get to a situation where they're going to pay, if nothing happens, they're going to pay $300 to $400 a month per person. plus any deductibles, and they're saying, wow, this is blowing us out of the water. We really need to readjust things because this is a huge additional expense we're incurring heading into retirement. Okay. And then the flip side of that is people coming from very expensive health care that they have been paying anywhere from $1,200 a month to $2,000 a month or more just for health insurance, and then having all the deductible and additional copays on top of that. So they've been bearing a very heavy burden, and they look at this and say, wow, we can get health care for $300 or $400 a month.
Right.
That is fantastic. So again, it drives you back to your own situation. What's going on in your life? What does it mean for you? And that's the planning aspect in all this and how you merge all this together. So as it stands right now, Caleb said, receive no questions, but Cathy Mears with Group Benefits Limited, and you just want to display your contact information there on the end?
I think it's on the top of that
Okay.
sheet.
Well, it is on the sheet that we emailed out to you, and we will be sending the recording out to everybody too. So we appreciate you attending today.
Perfect. Thank you very much for having me.
Have a great day.